Go ahead.
Hello, this is Dr. Fred Garcia again, talking about one of the many modalities that we do perform here at Quantum Medical Associates. The question today is, what do I do if I'm losing my hair? And the best approach, the quantum approach, is to first of all do all the simple things that would help you maintain what hair you have left. And then the next step is to enhance the nutritive as well as the growing properties of your hair. There are three different stages of hair growth. One is the anagen phase. That is the rapidly growing phase, which can be kept going throughout the month up to 78%. Then there is the catagen phase, which is a slow growth period. And men and women all know about, sometimes you have to go to the hairdresser or the barber, once every month or 6 weeks, and then sometimes it's longer, and it varies as you get older. So first is the anagen phase, rapidly growing. Second is the catagen phase, slow growth. And then there's the telogen phase. Gentlemen with a male pattern of hair loss, the telogen phase is where the hair stops growing, and then it becomes fuzz, and then you lose it. And those are the three processes. Well, a no-brainer as far as quantum natural healing protocols, therapies that you can start today. Number one, they have found, and in my research, it's true, that biotin is a very important B vitamin that many people are low in, and it especially affects hair, skin, and nail growth. So I suggest and give my patients 10,000 milligrams a day of biotin, and I give them a 90 capsules for 3 months. So that's nutritional, no brainer. And then for those that have had the hair transplant or the FUE, then, or people that have never had any hair procedures, the nutritional as well as the laser. The laser therapy, what it does, remember we talked about the three phases: anagen, rapidly growing; catagen, slow growth; telogen, no growth. The laser, because it is calibrated, and lasers can go at any depth. Our lasers are specially calibrated to go 6 to 8 millimeters below the scalp line, where all of the hair follicles are, the roots. And it stimulates those roots, and it stimulates those hair follicles to stay in the anagen phase, rapidly growing. And that's me. I do that several times a week. I have 3 lasers in my Beverly Hills offices, and they're going all the time. Anyway, so that is the laser quantum healing approach. And then we also have some technology that we acquired from Australia. It's called the Trioxy, and this is put out by Oxy Air. It is pressurized oxygen with nutritional elements. Now, when we apply this, it's good for the skin, and also for collagen and skin rejuvenation, as well as for hair stimulation. So we have gentlemen and ladies that come in for the laser for the hair, and the Trioxy, the pressurized oxygen nutritional, for face and hair. And we have had patients that have done just the things that I've talked about so far, and they've had hair growth, significant hair growth, in areas where they were completely bald. So that would be the quantum approach that we would give to all patients, as well as those that have our state-of-the-art cutting edge FUE procedure. That's follicular unit extraction with stem cell augmentation. Now this is a very, very new treatment that I do in my offices in Beverly Hills. And the history of hair transplantation. In the old days, they would take out plugs, they put them into the bald area, and it grows. This hair along the sides and the back is called the Hippocratic wreath. Why? Because Hippocrates, the first doctor, was also bald, and this is the immortal hair. And I could spend time and talk why you have hair here on your underarms and in your pubic areas. It has to do with embryonal hormonal sensitivity, and that's another lecture. But anyway, this hair is immortal hair, and I use it for creating eyebrows, goatees, and I do have a very large, probably the largest transsexual patient base in the country, where men wanting to transfer it into women. The problem is they have the recession. So I do a customized hairline with a little widow peak. They love it. I've had patients from all over the country as well as from Canada. Okay, so 50% of women have lost 50% of their hair if they're over 50 years of age. Very simple, 50, 50, 50. But women, you don't notice it because they move it around, it's on top. And they're ideal candidates for the laser and the trioxy treatment. So the best treatment available today for hair restoration, and my results, I would stack them up against anybody. They're public knowledge on my website. Okay, the best treatment is to take out the plugs and then have them marinate. Marinate isn't a good word. In stem cells. Stem cells can stimulate the hair growth once implanted, and one hair can become 2 or 3, so you have a multiplier, plus the quality of the hair is much better. I do not do any hair restoration procedures without stem cells because the benefit is so great. It's more expensive, but still you need to do it. Anyway, so the best treatment today is FUE, stem cells, followed by laser trioxy with a bionutritional supplementation. And that's what I do in my 2 offices in Beverly Hills. Please call for an appointment for a free consultation. Thank you.